Reset.
Welcome back to Inside Chlorpromazine, the podcast that takes you deep into the science of chlorpromazine and its fascinating potential in treating viral infections, especially in the context of COVID-19. I'm your host, Sowmya, and today we are going to explore a crucial aspect of chlorpromazine's role, its impact on immune modulation, particularly in patients suffering from COVID-19. In this episode, we'll dive into how chlorpromazine interacts with the immune system and how it might help in managing not only the acute phase of COVID-19, but also its long-term effects. To help us with this topic, we have Chythanya, a biochemistry graduate, a microbiology researcher with expertise in immunology and antiviral therapy. Welcome to the show, Chythanya.
Thank you, Sowmya, for inviting me.
That sounds amazing, Chaitanya. Now, let's talk about the immune system. As we all know, COVID-19 can cause significant immune system dysfunction, particularly in severe cases. Can you explain how chlorpromazine might help modulate the immune response, especially in COVID-19 patients?
Absolutely. In COVID-19, one of the main challenges we face is an overreactive immune response. This is often referred to as cytokine storm, where the body releases an excessive amount of immune molecules, which can lead to widespread inflammation and tissue damage. Chlorpromazine has been shown to have an effect on the immune system by helping to reduce this excessive inflammatory response. So, one of the ways it does this by inhibiting the activation of certain immune pathways that are involved in inflammation, such as the NFKB pathway. By modulating these pathways, chlorpromazine can help reduce the production of pro-inflammatory cytokines, which could prevent or mitigate the cytokine storm that's often seen in severe COVID-19 cases.
That's really interesting. So, chlorpromazine essentially acts as a regulator, helping to balance the immune system's response.
Exactly. The key here is that chlorpromazine doesn't completely suppress the immune system, which would be harmful, but instead helps regulate it. It keeps the immune system response in check, making sure it's not overreactive, which is particularly important in disease like COVID-19, where the immune system's response can sometimes do more harm than good.
So, in a way, it's a moderator of the immune system, ensuring it functions properly during an infection.
Yes, that's a great way to put it. It helps ensure that the immune system responds appropriately but doesn't spiral into a hyperreactive state that could lead to complications.
You mentioned cytokine storm and severe inflammation, which are the major issues during the acute phase of COVID-19. What about long COVID? Many people who recover from the virus continue to experience symptoms like fatigue, brain fog, and persistent inflammation. Could chlorpromazine play a role in managing these long-term effects?
Yes, and that is where chlorpromazine immune modulating effect could be especially valuable. Long COVID is thought to be particularly driven by ongoing inflammation and immune dysregulation, even after the virus has been cleared from the body. Chlorpromazine, with its ability to help regulate immune response, might be useful in treating these lingering symptoms. In fact, several studies have looked at the impact of chlorpromazine on persistent inflammation in other conditions, and there is a possibility it could be beneficial for long COVID patients as well. By reducing the levels of chronic inflammation, chlorpromazine could help alleviate some of the lingering symptoms such as fatigue and muscle pain that many long COVID patients face.
That's a fascinating angle. So, chlorpromazine could potentially help out just with the acute phase of COVID-19, but also with the aftermath for many patients.
Yes, exactly. Long COVID is still being studied, but it's clear that immune dysregulation plays a significant role. By modulating this dysregulation, chlorpromazine could help prevent or reduce some of the long-term complications that we are seeing in COVID-19 survivors. Of course, much more research needs to be done, but the early signs are promising.
That all sounds very promising. But like any drug, there must be challenges or limitations when it comes to using chlorpromazine for immune modulation. Can you share some of the challenges researchers are facing in this area?
Certainly, one of the main challenges is understanding the precise dosage required for immune modulation without causing side effects. Chlorpromazine is already known to have a range of side effects, especially at higher doses, including sedation and potential cardiovascular issues. So, finding the right balance where it can modulate the immune system without causing harm is very crucial. Additionally, chlorpromazine's effect can vary depending on patients' individual characteristics, such as their age, overall health, and whether they have pre-existing conditions. This variability can make it difficult to determine a one-size-fits-all treatment approach. Furthermore, because chlorpromazine is primarily an antipsychotic drug, there may be concerns about its use in patients who are on the other medications that interact with it. So, be careful management and monitoring are very essential.
With those challenges in mind, what kind of research is being conducted right now to explore chlorpromazine's immune modulating effects? Are there any clinical trials underway?
Yes, several clinical trials are investigating the use of chlorpromazine for COVID-19, particularly focusing on its potential to modulate the immune response. So, some studies are looking at its effects on inflammation and the cytokine storm, while others are examining its role in preventing or alleviating long COVID symptoms. These trials are still in their early stages, but the data so far has been promising. So researchers are also looking at chlorpromazine in combination with other treatments as part of a multi-drug approach. The hope is that by combining chlorpromazine immune modulating effects with other antiviral or anti-inflammatory therapies, we can create a more comprehensive treatment strategy for COVID-19 and other viral diseases.
That sounds very promising, Chaitanya. It seems like chlorpromazine could become a key player not just in the acute phase of COVID-19, but also in addressing some of the long-term effects that continue to impact many patients. As we wrap up today's episode, do you have any final thoughts you would like to share with our listeners about chlorpromazine and its potential?
I think the most important treatment takeaway is that chlorpromazine, although originally developed as an antipsychotic, has shown potential in treating a variety of viral infections, including COVID-19. Its ability to modulate the immune system could be make it valuable tool in the fight against not only acute COVID-19 but also long COVID. However, like all drugs, it needs to be studied further to determine the optimal dosage and treatment regimen and to ensure its safety in long-term use. We are in an exciting time for research, and it's great to see more attention being given to repurposing existing drugs like chlorpromazine to tackle new and emerging health challenges. So, thank you for having me, Soumya. It's been a pleasure to discuss this important topic.
And thank you to all our listeners for tuning into another episode of Inside Chlorpromazine. Be sure to join us next week as we continue our exploration of this fascinating drug and its role in treating viral infections. Until then, stay curious and stay safe.